Hemorrhoids. Hemorrhoids, also known as piles, are swollen veins in the rectum and anus that can cause discomfort and bleeding. They are commonly caused by 1. Straining during bowel movements. This is often due to constipation, making it harder to pass stool and putting pressure on the veins. 2. Prolonged sitting. Staying seated for long periods, especially on the toilet, can increase pressure in the rectal area. 3. Heavy lifting. Regularly lifting heavy objects can strain the lower body and increase pressure in the anal veins. 4. Pregnancy. The weight of the fetus can put pressure on the rectal veins. 5. Diet. A low-fiber diet can lead to constipation, exacerbating hemorrhoids. 6. Obesity. Excess weight can increase pelvic pressure, leading to hemorrhoids. Managing hemorrhoids with diet. A proper diet can help manage and prevent the discomfort caused by hemorrhoids by reducing constipation and easing bowel movements. Here are some diet tips. 1. High-fiber foods. Eat more fruits, vegetables, whole grains, and legumes. Fiber helps soften stool, making it easier to pass and reducing the need to strain. 2. Fluids. Drink plenty of water. This helps prevent constipation and maintain a soft stool. 3. Avoid spicy foods. While not a direct cause of hemorrhoids, spicy foods can irritate existing hemorrhoids. 4. Limit alcohol and caffeine. These can dehydrate the body and contribute to constipation. 5. Probiotics. Yogurt, kefir, and other probiotic-rich foods can help maintain gastrointestinal health and prevent constipation. By incorporating these dietary changes, individuals can significantly reduce the symptoms of hemorrhoids and improve their overall digestive health. शुक्रिया और इसका इंतज़ाम कैसे किया जा सकता है? ग़िज़ा से। आपके चैनल को सब्सक्राइब करने की दरख्वास्त के साथ, अगर आपको ये मालूमात मुफीद लगें तो बराए करम मेरे चैनल को सब्सक्राइब करें और वीडियो को लाइक करें ताकि आप ताज़ा तरीन मालूमात से बाखबर रह सकें। शुक्रिया।